introduce myself. Hi, I'm Katie. I'm just going to do a head-to-toe assessment today. Can I have your name and birthday?
Melissa Skaggs, 10/28/1989.
Okay, so then just make sure you ID them or whatever. And then what
Do you have to check for allergies? Or no?
I don't think so.
Okay.
You're not really using anything.
Okay.
I mean, if you want
Just checking.
to. I don't think I did though. So, okay. The first one is like inspect the head and facial features. So, I don't think you have to, but I was kind of like this to Brittany, like, okay, have you been having any headaches recently? She's like, no. I'm like, okay, facial features look good, symmetrical. So from there, I did the neck range of motion. So I did, okay, can you put your chin into your chest? And then look up at the ceiling, right ear to right shoulder,
I'm going the opposite way.
left ear to left shoulder, and then lateral rotation. Okay. Oh, and make sure when you're doing it that you have your hair up, because that's like a thing. I don't have your hair. Okay. So make sure you do all the range of motions. I even added one. I did like look right and look left. Yeah, just like do all of them basically. And then I was like, okay, I'm just going to check your lymph nodes now. I started with the preauricular. I didn't say them out loud, but I counted because there's 10, so I knew I was getting them all. So 2 is postauricular behind the ear. 3 is occipital, which is like at the base of the skull. 4 is tonsillar, which is like where your tonsils are right here. Submandibular is like right in here. Submental is right under the chin. And deep cervical is like, you can see it on her pretty good because it's like this muscle that goes down her neck. And the deep cervicals are right on that muscle. And then posterior superficial cervical is right behind the muscle. The anterior superficial cervical is like right along your trachea in front of the muscle. And then there's supraclavicular, which is above your clavicle. Okay, lymph nodes look good. And then I didn't do it in order that is on the paper. I did ears, eyes, nose, mouth. Because for all of those, you have to have gloves on. So I'll put gloves on.
Well, plus if you do it the way on the sheet, then you have to wash your hands.
Right, so just put on gloves right after you touch their lymph nodes. Just think of it like that, and you'll have them on for a while. And then with the ears, I just put hair behind your ears. And I just palpated and said like, okay, any ear pains, any earaches, discharge, anything, okay. Make sure you palpate the mastoid process behind your ear, just that bony thing. That feels good. And then, okay, I'm just going to look inside your ear. Make sure you look inside each ear, but pull up and back. And then just look in. And then up and back. And look in. Okay, that looks good. Then I go to the eyes. You're supposed to inspect them, like the iris. You know, that looks good. Your sclera is white. You know, you could just kind of say things out loud, like, okay, sclera looks nice and white. Iris looks good, you know, and then I'm just going to put on your eyelids and look at your conjunctiva. Okay, they're nice and pink. And then I don't know if you have to do, like, the upper ones, but I did just a little bit, just to make it look like I was, in case we had to. And then, okay, I said I would dim the lights. And then for this one, this is a consensual reaction, where they're both are supposed to contract. So I did this, both contracted away, both contracted. That eye's good. And do the same thing, just twice on each eye, to make sure they both contract. And then for the corneal light reflex, shine the pen light right in the middle of their eye, like right between the...
Like their nose?
Yeah, like their nose.
Okay.
And just make sure that the light reflects like equally in the same place in both eyes. And it will. So...
Did you talk a lot when you were in there or no?
Not a lot. I just like, if I felt like I needed to say something so she knew what I was doing.
Yeah. Okay.
Then just act like it's your patient. Like, okay, I'm just going to shine a light in your eye. You know, whatever.
Okay.
And then the cornea, just have them look straight ahead. Shine the light, like to the side. Make sure the cornea looks like you're looking for it to be nice and smooth, which of course it is. Okay, so that looks good. The last one is a accommodation. So you're going to have them look at something distantly. So pretend this is further, but just look at this. And then focus on my finger. Okay, and their pupils should constrict when they look close. Yeah, and cross-eyed. So they should come in together and constrict when they're looking at a distance. Their pupils are bigger.
Okay.
I think that's it for eyes. I'll double check when I'm all done with this. But for the nose, you just palpate it. Any pain? Have you been having any congestion? No? Okay. Can you breathe in through your nose for me? And one more time. Okay. So that's the patency of the nares. And then can you just tilt your head back for me? And then look up your nose. Looks good. Okay. Then I go to the mouth and throat, just because it's easier to remember ears, eyes, nose, mouth. You're working your way down. Okay, so I started out with the lips, just like a general, okay, lips aren't blue, so that's good. And then I used the pen light at the same time, but I just kind of went like this with the wood stick. Okay, lips look good, lips look good. And then I had Brittany open her mouth. Can you open for me, please? Okay, and then I don't want to stick this in here, but I stuck like the wood stick in there. And I just like pulled like her cheeks to make sure, you know, I look down. Can you put your tongue on the roof of the mouth? Look under. Okay, thanks. And then look up at the roof of the mouth. I stuck the wood stick in there and I put the light in and I said, can you bite down to make sure like she was biting down like equally or whatever.
Did you do it on both sides?
Yeah.
Okay.
Like I looked at this side, said bite down, and then bite down to make sure they were even.
Okay.
Okay, so can you stick your tongue out and then put it right back in? Yeah, or they'll go like, that's just checking to make sure the nerve is like a frog. Yeah, got it. Okay, and then, let's see what else. Okay, can you open wide for me, please? I just put the wood stick on her tongue and said, okay, can you say ah? Okay, and then just say, oh, your tonsils.
We have to do that 3 times, is it? I thought you had to say ah, like, I think you have to say ah,
I mean,
like 3
do
times.
it as
Something
many
weird.
times as you think. Like,
Okay.
if you think 3, then do it 3 times. Because she's not going to mark you off on, like, doing something extra.
Yeah.
You know what I mean?
Yeah.
So, I think that's it for the mouth. Okay, then, then take off your gloves and wash your hands. But she'll have hand sanitizer, so when you're saying I'm washing my hands, you really are rubbing in the hand sanitizer. So it's kind of easier to remember.
Okay.
And then I went around to I went around to the back first, just to get that out of the way, because that's really the only thing I'll be doing on her back. So I went around to the back, and I looked at her AP diameter. Do you guys know what that is?
Yeah.
This. Just go like this, like this. It's going to be even. Just say, okay, you know, 2-to-1 ratio or whatever looks good. And then, okay, on the back, I'm going to listen to her lungs, have her take a deep breath for each one, but also there's 10 places to listen to in the back and 8 on the front.
Okay.
And you're going to start like up here on the back. Can you take a deep breath? Okay, then do you guys know the order? Like,
isn't it like
pattern?
a kind of zigzag?
It's across and down. Yeah. So 3, and I just count in my head, you know, so I know like 4. Okay, then 5, 6, 7, 8, 9, 10. You should end up like down here, like where like the bottom of her lungs would be.
Okay.
And then what I did is went around. Sorry. Went around to the front, and then I listened to. She said like not to do like the front and the back of the lungs like at the same time because people get out of breath. So if you want, you can listen to her heart and then go back and listen to her lungs. It's up, it's up to you. So I'm gonna listen to your heart just to give you a break from deep breathing.